Today's presentation is an overview of healthcare systems. In this course, there are three main units: the healthcare environment, the business of healthcare delivery, and professional development. Within the unit of the healthcare environment, you'll learn about the environment in which you'll be practicing as a future PT and OT. In the business of healthcare delivery, you'll learn about the business aspects of healthcare that will help you to not only make appropriate patient decisions, but be able to function most effectively within the system. And then professional development, which will help you again to become the best PT/OT you can, providing the best quality of care for your patients. Within the first unit, the healthcare environment, we'll do an overview of non-U.S. and U.S. healthcare systems, which is the presentation for today. We'll review your leadership role within healthcare, and we'll look at the Affordable Care Act so you have a good understanding of the general tenets of the Affordable Care Act and how that impacts healthcare, as well as looking the impact that political processes have on healthcare, and looking at how the platforms of the upcoming presidential candidates might have an impact on healthcare. In order to really fully understand your respective role as an OT or PT within the healthcare system, you first need to have an understanding of the environment itself that you'll be practicing in. The U.S. healthcare system is significantly different than the healthcare systems of other countries, and I'll review those other countries with the non-U.S. systems in this presentation because it really helps to provide a context for our own U.S. system. There are a couple of factors that cause differences among health service systems, and the definition of health services is really a broad designation for any activity that relates directly or indirectly to the delivery of health services. So this would include planning, financing, delivering, measuring, and analyzing physical and mental health services, and the development and provision of health-related products. So this term health service, when I use it, is more than just what we typically think of as provision of services. It's really much more than that. So two factors that cause differences among different health service systems in different countries is the amount of government involvement in health service, and we'll talk about that quite in depth with each of the health service systems, and the resultant public policies that relate to the provision of healthcare. So public policies are government policies that express general principles used to guide the management of public affairs. So the greater the governmental involvement in health service, as you'll see in other countries, the greater there is a need for these public health policies. And these policies deal with things like eligibility, who will receive services, access, how will those individuals obtain the services, then quality, efficiency, effectiveness, and we need to know how that will be measured. And then finally looking at cost benefit or value-based. And this concept of value-based healthcare will come up over and over in today's presentation and is really the way that our current health service system within the U.S. needs to move for various reasons, and I'll review those. This concept of value-based healthcare means that we want to achieve the best outcomes with minimal cost and high quality for our patients. U.S. health service system has less governmental involvement in the overall health service operations, and you'll see how that impacts the functioning of our system. Therefore, public policies in the U.S. have more focused on care for selected constituents rather than all of the population. And you'll see this as a significant difference as we look at some of the non-U.S. health service systems. But because of this has in the U.S. allowed service providers in the private sector to flourish because there's less overall governmental control. There's a higher amount of private sector involvement. So this has allowed providers, equipment and supply vendors, and businesses really to expand and flourish within our system. A useful way to compare different healthcare or health service systems is to categorize them based on the degree of governmental involvement in the planning, financing, and controlling health services. So on this chart, you'll see that on the horizontal axis, it moves from most government control to least government control, where the vertical axis looks at the amount of private sector involvement, moving from the lowest amount of private sector involvement to the most involvement of private sector involvement. You can see that the communist system, which I'll review in a moment, has the most governmental control and the least private sector involvement, where the U.S. entrepreneurial system has the least government involvement and the most private sector involvement. The communist health service system impacted the former Soviet Union, so the Soviet bloc countries. This ended in the early 1990s. But this health service system was based on tenets of communism, and one of the guiding principles of communism is that it does not recognize the right to private ownership. So it really makes sense that there was a lot of government control over this health service system. The government really looked at itself as the caretaker of society. Private sector involvement in the system was negligible. Remember, it's on that far lower left of the graph. And the positives were there was universal access to health services, but the services were often unequal, meaning that some services were paid for more or less. For example, some medications were paid for and covered while some were not. In the communist system, health service was recognized as a right of citizenship, and therefore every member of society was entitled to free health care, and therefore public policies were reflected of this. The socialist system, an example of which is Germany, but really most of the European Union countries have a socialist system of health service. Within socialism recognizes the right to limited private ownership. So there's still a large amount of governmental control, but we begin to see a little more private sector involvement in the socialist health service system. In socialism recognizes the right to limited private ownership, but the government looks at healthcare as being a right, again, for the entire population. And this is to ensure, and there's high government control, and this is to ensure equitable distribution of that resource of healthcare. So certain services are controlled by the government when they benefit the entire population, the example being healthcare. Healthcare within the socialist health service system is financed in two different ways, through what are called sickness funds and through private insurance. These sickness funds are financed and provided, they're provided by employers, trade associations, or professional associations. The funding for the sickness funds comes from both the employers and the employees who share the costs, and the cost for employees is based on income. The positives of this system is that there's a significant ease of access and timeliness with receipt of care. The negative is that there's often poor communication between hospitals and private physicians. The comprehensive health service system, which is unique to the United Kingdom, also is called the National Health Service. In the National Health Service, in this comprehensive health service system, there's again still extensive government control. It's still a socialist model, but it provides a little bit larger component of private sector. So it provides a full spectrum of health services, which are funded 86%, again, majority through public funds, taxes, 12% through payroll taxes, and 2% from users who receive dental services and prescription drugs. So again, it's a universally available health service, just as the previous examples, but there's a larger component of this privately available health service. It's a very cost-effective system. They have better than average outcomes, and they have very acceptable patient satisfaction. And for this reason, the comprehensive health service system is really being studied by other countries to see if there's aspects of it that can be incorporated into their own countries to improve the provision of health services. The concerns with the comprehensive system are that there are fewer physicians than are in other countries. There is underfunding of the services, and there's a projected increase in demand for services, which is true in most countries. But again, it's looked at as being a very cost-effective and positive value system. The welfare health service, unique to Canada, is significantly different than the other health systems. They still have a fair amount of government control, but that amount of government control is decreasing and there's more private involvement. So again, if you picture that graph, we're moving up and to the right, less government, more private control. Health service is considered a right of Canadian citizens, and the health service provides nearly universal accessibility. Their insurance is known as Canadian Medicare. This is very different than our Medicare system, which really applies to the elderly and individuals with disability. Canadian Medicare really applies to all ages. It's a publicly funded system, but individuals can also have private insurance. The role of the federal government is that it sets and administers the health service standards, and it assists with funding. But after that, the provision of services is really up to the provincial and territorial governments. So these would be similar to state and local governments in the U.S. So it's up to the provincial and territorial governments to manage, deliver, and secure additional tax revenues to fund it. So you can see how the provision of services might vary significantly in different provinces and territories. And in addition to the amount of additional revenues that each province or territory is able to fund, they also make a decision about coverage beyond the core services. So again, each territory may be different because the coverage may be different because they've made different decisions regarding services and benefits. The problem with the Canadian system is that there's low physician to patient ratios, there's a decreased breadth of services, and this has resulted in significantly long wait times and wait lists. And many individuals in Canada, if they can't afford it, have purchased the private insurance because it helps with getting in for being able to receive the needed healthcare services quicker and maybe at a different level than they would have been able otherwise. The main question with the Canadian system is one of sustainability. So there's a significant question of whether this system, which is publicly funded, can be maintained. And that brings us to the entrepreneurial system of the U.S. So again, if you picture that graph, we've moved to the far upper right. So we've moved to the least amount of government control and the highest amount of private sector involvement. So in the U.S., there's a large private component, so the private insurances, and there's a slightly smaller public or government component. The public component or the governmental component is funded by payroll taxes and federal state revenues. The private component comes from generally out-of-pocket expenses, which are out-of-pocket expenses either for the individual who has the insurance, maybe for employers who are providing insurance. It comes from the insurance companies because they are reimbursing providers for care, and it comes from philanthropy. The U.S. entrepreneurial system is a very decentralized system. It's not highly controlled by the government because the public government component is much smaller than in other countries. And in addition to this, the U.S. Constitution has been silent on the responsibility of the federal government for the health services of its citizens. So for this reason, because it's not indicated in the Constitution, by default, it makes health services the responsibility of the states, and that has caused some differences not only among states in the provision of healthcare, but again to some of the difficulties that our health service system has been experiencing over the last several years. The governmental portion of the entrepreneurial system is funded through taxes, and this funds the Medicare and Medicaid programs. The private sector is a work-related benefit, so you work for an employer and you receive health insurance as a benefit through that employer. But this has also resulted in high out-of-pocket costs, again, either for the individual receiving care or the employers who are providing the services. There are government and private third-party payers, so it's a multi-layer system of payers. Again, that makes it a much more complex system, and that combined with this lack of one governmental entity overseeing the system has led to difficulties within this complex system. The per-person expenditures are the highest in the world. So individuals in the U.S. have the highest amount paid toward healthcare compared to any other country in the world. And this multiple payer source format of our entrepreneurial system has really resulted in inefficiencies and increased costs. So again, there's no federal government body that's responsible for health service planning for all U.S. citizens. The Health and Human Services is responsible only for financing and managing the government-initiated social and health benefit programs. But we have this large private component that is really not overseen by any one body. So how did U.S. healthcare become so different? One reason is that we have a federalist form of government. We have a delineation between local, state, and federal government. This has led to that decentralization of health service because it is not thought to be the government's responsibility to oversee the system because it has this large private component to it as well. Also, U.S. political ideology is linked to capitalism. Capitalism favors a market orientation, and this has developed the U.S. entrepreneurial public-private health service system. So it's developed as a business within the country because that is capitalism is one of the tenets of our society. The public health service serves those most needy. This is Medicare and Medicaid, whereas the private portion of the health service system in the U.S. is employer-based insurance. So the employer provides the insurance, or an individual finds their own health care plan or pays out of pocket for health care costs. Obviously, there's advantages and disadvantages to the U.S. system. The advantages are we really have the most responsive system. Individuals do not need to wait for non-emergency care. It's resulted in the development of medical technology, techniques, and new drugs. We have a sufficient and well-educated and trained workforce, which is not the case in other countries. We have sufficient facilities. Many will now say that we have too many facilities which are not cost-effective in providing care, and we'll talk about that a bit as we look at this concept of value-based healthcare. And we have many innovative programs. The disadvantages of our system is that it is the most expensive system in the world. Again, we have the largest expenditures for healthcare per person in our country, and there's really no evidence that this equates to improved outcomes, patient outcomes. Government health policies are public policies that affect the health of citizens. So government policies that express general principles used to guide the management of public affairs. Health service policies often consider these things, which we've already touched on. Eligibility, who's going to receive the services. Looking at quality, efficiency, effectiveness, and how that's going to be measured. Looking at cost benefit, the outcome of the service provided compared to the cost that it took to provide it, or the economic values, the cost of providing care to all who may need it. Key service policy areas include protecting the health of the population. These are, when policy is put into effect, these are the aspects that it addresses. Protecting the health of the population, building the infrastructure to protect public health, managing and regulating the health services, collecting and disseminating information about the health service system, and above all else, looking at financing. This all brings us to the need to examine healthcare as a business. The healthcare industry in the U.S. is very important to our economy. It provides 13 million jobs. But healthcare is entering into a future where we have increasing numbers of people who need healthcare services as the baby boomer generation continues to grow. And there's no more money entering the system. So we really need to look at a more sustainable way to continue providing health services within our country in a more cost-effective way. The annual U.S. healthcare expenditure in 2014 was $3.8 trillion. This is a huge expenditure. And as we look at percentage of gross domestic product, which I'll review in a moment, you can see how the percent of that gross domestic product in the U.S. has increased steadily from 1965 to now being at about 17% of our gross domestic product, a significant increase in expenditures. Gross domestic product is the monetary value of all finished goods and services produced within a country's border in a specified time period. So within any given year, the amount of healthcare that's provided is considered a finished good and services. So we can look at the contribution of healthcare as an industry to the U.S. gross domestic product. If you look at this slide, which shows health expenditures as a percentage of gross domestic product, this is the world. And you can see compared to 1995, the percent of health expenditures contributing to gross domestic product in multiple countries through the world has steadily increased. There's some up and downs, but it's definitely gone from lower to higher. But if we look specifically at the United States, so here's an overview of each country. It indicates the percentage that their healthcare expenditures contribute to their gross domestic product. If we scroll down to the U.S., we see that the U.S. is at 17.1%. Health expenditures contribute to 17.1% of our gross domestic product. And again, you can see how that significantly increased in the past 20 years, from 13.1 to 17.1. And you can compare that to the other countries. So what I'd like you to do is look at the health expenditures for the following countries, which are the countries that we reviewed their health service system, and compare those health expenditures to the U.S. Other healthcare outcomes that we can look at, which is very important. We have a very effective system. Our health service system has resulted in increased life expectancy and low mortality rate. So again, we can look at this in comparison with other countries. So life expectancy at birth. We can see overall, if we look at all countries, we see a significant increase from 1960, when the average age of life expectancy was 52.5 years, to 2014, 71.5 years. And again, you can scroll down and look at life expectancy in individual countries. Again, this is as of 2014. And we see that the United States is 79, so one of the highest rates of age of life expectancy. Similarly, we can look at mortality rate. So we hope that infant mortality rate per 1,000 live births we would hope that that steadily decreases. And that is what we see. Again, this is comparing multiple countries in the world. 122 deaths per 1,000 live births in 1960. For the world, the average has now decreased to 31.7. So 31.7 for the world. And if we look at the U.S., we see that the average is 4 infant deaths per 1,000 live births, so a significant decrease. So the positives of our health service system is it has resulted in higher life expectancy, lower mortality rate. But the issue is that it's being provided at a very high cost. So we need to look at healthcare as a market economy. So market economy is defined as an economic system in which economic decisions and the pricing of goods and services are guided solely by the aggregate interactions of a country's citizens and businesses. So it's supply and demand. You have high supply, that may lead to, if you have high supply, that may lead to lower demand. If you have high demand, that may lead to lower supply. A market economy has little government intervention or central planning, and that's consistent with our health service system with a combination of governmental and private sector. A market economy is the opposite of a centrally planned economy in which government decisions drive most aspects of a country's economic activity. So again, our health service system has low governmental control, so it's not a centrally planned economy. So it really meets the definition of a market economy. But the healthcare market is really unlike other consumer markets in our country. And really, some will say it's truthfully not a market at all, because supply and demand does not control prices or limit market growth. We will always have high demand for services. We always have high supply of services, but this has not impacted prices in a positive way. Prices have continued to increase. And in the healthcare market, health insurance pays for healthcare costs versus the individual paying for healthcare costs, as would occur in other consumer markets in our country. Because the consumer doesn't pay for healthcare, there is no limit on demand because they have some type of health plan that at least partially pays for healthcare. So this next graph, we look at out-of-pocket health expenditures, so what individuals pay for health care. And again, we compare it to what occurs comparing a number of countries in the world. And again, we compare from 1996 to 2014. You can see there was a significant decrease in expenditures down to 2002, and then we see a steadily increase again in expenditures in the world, where we're ending up with an average in the world, 45.5% of out-of-pocket health expenditures. So this is the percentage of private expenditure on health. So 45.5 within the world. And then if we look at the U.S. numbers, we actually see that they're a little bit lower than that. So 45.5 in the world, 21.4 in the U.S. And we've seen a decrease in out-of-pocket expenses, however, not all that significant, from 26% down to 21%. So still a significant percentage of expenditures are related to healthcare, and later on we'll talk about the importance of that and how that might impact our economy. Here's the current healthcare payment structure. An individual needs healthcare services. They have some sort of assistance with that through their health plan. They receive the service, the health plan reimburses the provider for the insurance. That's really our current state of healthcare payment, and that's known as fee for service. You receive a service, somebody pays for that individual service. The future state of healthcare needs to move toward this concept of value-based healthcare. And one aspect of this is the concept of bundled services. So value-based healthcare will look at the value of healthcare. So it will look at the quality compared to the cost. We want high quality, low cost. That will lead to higher value. One way to do this would be to incorporate the use of what are called bundled services, which we'll talk about later in this course, where an insurance company or health plan will provide a certain amount of money to a provider system, like a hospital, to provide all of the services that relate to any given diagnosis or condition of a patient through their whole episode of care. That may move from the hospital to a skilled nursing facility to home. And the hospital will receive one payment for that, and they need to be sure that they utilize that resource most effectively as they can. So what we care about with healthcare, again, is value. So high quality, low cost. And currently, price and payment are not necessarily related. There are very high prices for healthcare. Currently, payments are low for healthcare, and both of them together do not necessarily positively impact value. So poor quality of healthcare can actually result in higher prices, because poor quality of healthcare may cause an individual to seek even more healthcare services, thus increasing the costs. And poor quality then results in higher payments for healthcare. And there's really been runaway growth in the demand for healthcare services, and the cost has significantly increased. So we need to look at this relationship of price and demand. And these are the reasons why price does not affect healthcare demand. The buyer, who is the consumer, the patient, and the seller, who is the provider, that relationship is indirect because the buyer does not pay directly for the service that they're receiving from the provider. Usually a health plan is paying for a portion of it. The person requesting the health care may not be the actual patient. So in the case of a parent requesting health care for a child or a minor, or a medical power of attorney requesting health care for the individual that they have power of attorney with, the patient is typically different from the party paying for the service. So again, in a market economy, if you want to purchase something, you go out and you spend your money and you pay for it. Within healthcare, the party who is paying for the service is generally the healthcare plan. It's not the patient themselves. So the payer, the insurance, may be different, and the payer, which is the insurance, may be different than the party who funds the payer, which might be the employer, it might be government. So for this reason, the price of healthcare doesn't affect the demand for healthcare. The consumer often doesn't know the price of services they're purchasing. And even if an individual asked how much a service would cost, it's very difficult for a provider to give them an accurate answer because of the complexities of our system. So often the consumer doesn't even know the price of the services, the health services that they're receiving. And healthcare is not a discretionary expense. So discretionary expense is a cost that is not essential for the operation of a home or business. Healthcare is essential for the operation of a home. It's a requirement. Therefore, it will always be high demand, and there is no control of costs or price. Furthermore, the consumers, who are the patients, have difficulty determining the quality of healthcare. In their mind, the quality may be determined by the outcome they receive. it may not be the outcome they expected. And so they rely more on looking at the quantity of services that they receive, or the interpersonal skills of the providers, or the speed of the service, and equate that to quality, when really that's not an accurate measurement of quality. And the unlimited demand of individuals for health services encourages providers to offer more services. Remember, we're currently in this fee-for-service system where you provide a service, you get paid for it. And there's additional amenities that have increased costs, and these costs are passed on to the payers, who are the healthcare, the health plans, the insurance companies, the third-party payers, and the government. If we look at healthcare spending, we see that hospitals account for the majority of healthcare spending, almost 31%, followed closely by physician services at 20%, prescription drugs at 10%, nursing and continued care at 5.4%. There's costs associated with administering the health plans, that's at almost 4%. And then if you look at the color key to the right, there are the kind of reddish, smaller triangle is other professionals. That's probably where OT and PT would be. And so you see that OT and PT accounts for a very small percentage. I'm estimating less than 2% of healthcare spending. Really, the majority is going toward hospitals and physicians, so well over 50, about 50%. And of the healthcare expenses, 72% are paid for by insurance, 12% come from out-of-pocket, 8% come from other third-party payers and programs, 6% might come from investments like a health savings account, and 3% might come from government or public health activities. And if we look at that 72% of health insurance, the breakdown for that is indicated on the right. Private insurance accounts for the largest majority of health insurance. So again, we're in that entrepreneurial system, low government control, higher percentage of private sector, slightly less governmental control over our health service system. So 33% of health insurance is accounted for by the private health insurance, 20% by Medicare, 7% by state and local Medicaid, and 9% by federal Medicaid. So that's a distribution of where those health dollars come from. Our U.S. healthcare system has, again, two different levels, the government level and the private level. And now we're looking more at healthcare systems as to who owns the system, who operates those systems. So within the governmental system, we have federal, state, and local. So at a federal level, we have Department of Defense, Department of Health and Human Services, Department of Justice, Department of Veteran Affairs. Then we have some state healthcare systems, and we have local healthcare systems. So these are some of the hospital systems that you might be familiar with. And then we have this private system. So private healthcare systems can either be for-profit or they can be not-for-profit. And in the Milwaukee area, we have many not-for-profit, larger hospital systems. So government healthcare are healthcare provider enterprises owned by the government. So these may be known as governmental, public, or tax-supported facilities. So the VA system is an example of government healthcare. Healthcare in the private sector has two designations. An organization can either be a for-profit entity or it can be a not-for-profit entity, and this is based on IRS requirements. A healthcare for-profit is formed to make a profit. So the owners of the for-profit organization take that profit for personal use. They may sell shares of stock to the public through stock exchange, and then those individuals also will receive dividends, and they will receive profits when they sell their stocks. And these corporations are known as publicly traded corporations. Those who buy the shares are known as stockholders. Stockholders buy shares with the expectation that they'll earn dividends while they own the shares, and a profit when they sell their shares. So this is the typical New York Stock Exchange companies. Taxes are paid by the corporation as well as by individuals who gain from the operation of the profit. Whereas not-for-profit healthcare, they're still a business. They still need to make money to stay afloat and provide services. But not-for-profit businesses are formed to help the community at large. So many of the large hospital systems in the Milwaukee area, for example, are not-for-profit. They expect to make a profit, but they take those profits and they put them back into the business to grow and improve their offerings. And they were formed initially to help the community at large. And this is why these hospital systems, for example, provide pro bono care and free care to the community, because that is one way that they can help the community at large. The main difference between profit and not-for-profit lies in what happens to the profits or losses. So other than a receipt of market competitive compensation for services provided, no individual or group individuals is allowed to benefit from a not-for-profit business. The profits go back into the business. A not-for-profit entity is required to invest those. Again, our entrepreneurial system in the U.S. is a multi-payer system. We have really two different layers. We have the employer purchased or now individual purchase health insurance. That's the private sector. And then we have the governmental control support, which is tax-supported health care. So these are some of the programs that come under that. Medicare, Medicaid, Workers' Comp, Public Health, Department of Defense, Veterans Affairs, Indian Health Services, and state and local subsidies and school health programs. So here's one of the problems with healthcare. Even though the governmental aspect of our health services is a minority percentage, the government sets the price that it pays for healthcare related to the government system. And the problem is this figure has been decreasing, and has decreased to the point where sometimes the amount that someone is reimbursed for providing a service is actually less than what it costs them to provide that service. And a good example of this is the fee schedule for Medicare. Medicare, which is a governmental entity, says, I will pay this amount for this service. I don't care how much it costs to provide it. This is how much you'll be reimbursed for providing that service. And so many health provider systems then rely on the private insurance, which may reimburse at a higher rate, to help them make up for some of the losses that they might see by providing care to individuals under these governmental programs like Medicare and Medicaid. But you can see by the graph, and what also happens is that as the government decreases the prices it pays, for example, Medicare says, I'm going to pay this amount. Many times the private insurance follows suit and they utilize similar guidelines, and this has led to a significant problem. And so you can see as the payment of Medicare and Medicaid as governmental programs has decreased, that requires that private insurance begin to increase to shift the payment onto more of the private insurance companies. And within a health provider system, this is an issue because many systems have limited the number of patients with Medicare, Medicaid that they will accept or provide care to and they want to increase the number of individuals with third-party insurances because they know they'll get reimbursed at a higher rate, and it's their way of staying in business. More household income is being spent on health services, and the issue with this and the impact that it has on our economy is that leaves less money to cover other costs. The number of employers that are offering health service coverage is declining. It's very expensive for employers to pay the premiums for their employees for healthcare insurance, and especially small companies simply cannot afford it. And so the number of employers offering health service coverage is declining, even though it has increased with the passage of the Affordable Care Act. And when employers do offer health plans, because they're paying higher and higher premiums, they've often needed to pass on the financial burden to the employee. If they don't increase the premium, the percentage of the premium the employee has to pay, so the monthly amount that each employee pays for insurance, they provide plans that require higher deductibles, so higher initial out-of-pocket expenses for the individual that they have to pay before the insurance will pay. There may be higher co-insurance payments, which is the amount, the percentage of the full cost of care that the insurance will pay for, or they have higher co-payments, which are a payment that's made to the provider at the time of service. And in this way, employers have begun to shift that financial burden onto employees. And again, this has an impact on our economy because as consumers, employees, individuals need to pay more for health care. They have less money to pay for other things, and this will negatively impact our economy. Individuals that have health care insurance through their employer may also see a reduction in their wages because their employer is having to pay higher health care premiums and therefore may not be able to pay as high of a wage. Or they may say to the employee, I can provide this level of health plan, which is a good plan, but you'll receive lower wages because of it, but perhaps you will have fewer out-of-pocket costs, and therefore the decrease in wages may be offset a bit. For less affluent households, though, lower wages could result again in people having to make decisions between, do I, for the amount of money that I have, do I pay that money toward health care, or do I have to pay for my other necessities of living? So on the upside, though, households may also benefit from increased health spending through improved health status. So if individuals have coverage for their health care, that may increase the likelihood that they seek out health care, and that can improve their health. And improvements in health status then obviously have a positive not only economic impact because they increase productivity, reduce absenteeism, enhance independence, but from a therapy perspective, it significantly can increase quality of life. So what needs to happen? Healthcare businesses need to reduce their cost of operations. Healthcare costs have skyrocketed. They're projected to continue to increase. We need to find ways to provide high quality care at a lower cost. We need to be more productive with the resources that we have. We need to be more accountable for delivering quality care. And these are really the changes that are coming up and that have begun with the Affordable Care Act, that providers now will need to demonstrate that they are improving health outcomes, not just that they're providing the care. And in the end, providers who provide higher quality health care with more positive outcomes at a lower cost will receive higher levels of reimbursement from third-party payers. And healthcare as a business needs to give quality care at a reasonable price. So we have this concept of this healthcare pot of gold. There's only so much money that is available for healthcare, and we need to figure out a way to make the largest impact for the largest number of patients. As we've already discussed, patient demand for healthcare continues to increase. We have no reason to believe that it will decrease. And unfortunately, at the same time, we've seen a supply of physicians continue to decrease for a variety of reasons. Could be the cost of education with becoming a physician. It could be the stresses associated with being a physician in the current healthcare environment, high productivity requirements, paying very high malpractice insurance rates, etc. But for many reasons, physician supply will not be adequate to keep up with demand. In this presentation, you've been provided with an overview of the U.S. healthcare system and how and why it's different than other healthcare systems in other countries. And you've now had the opportunity to view healthcare through more of a business lens and have seen that healthcare is indeed a business, an industry that has a significant impact on the U.S. economy. But it's also a business that needs to change to move toward a more value-based system where quality care is provided at a lower cost. And we need to figure out how to do that. That care will need to be provided utilizing current resources with improved efficiency, i.e. increased productivity. Now, I know that you probably didn't decide on a healthcare career because of the business aspect of it. But you do want to make a difference in people's lives, and you can actually do that much more effectively by understanding the business side of this healthcare industry that you'll be practicing in. So this final slide just summarizes what healthcare as a business needs to do. It needs to reduce the cost of operations, increase productivity with the current resources, be accountable for quality of care, and provide quality care at a reasonable price. And you as a therapist working within this business have a key role in helping to bring about the changes in healthcare that ultimately will even further benefit our patients.